Becca, you're now connected with Dr. Jonathan Aviv.
Thank you.
Hi, Becca.
Good morning.
How are you? Sorry about these
I'm
schedule
good.
changes.
Oh, that's no problem. It actually worked out better for me anyway. I had my phone on mute earlier this morning, so. If it's all right, I'll do a little intro, and then go right into the questions.
Yes, please.
All right. Dr. Jonathan Aviv is currently the director of the Voice and Swallowing Center at ENT and Allergy Associates in New York City. He's written a book called Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux, and is here to share some information from that book today. So, Dr. Aviv, what is your book about?
Becca, thank you. My book is about the connection between common throat complaints, such as chronic cough, hoarseness, frequent throat clearing, a lump-like sensation in the throat, to acid reflux from the stomach, and ultimately to esophageal cancer, which is the fastest growing cancer in America and Europe. My prescription, if you will, is a new diet I developed called the Acid Watcher diet, which is a low-acid, high-fiber diet that has a balanced amount of the three macronutrients, that being proteins, fats, and carbs, and it's designed to heal the body from years of acid damage. The recipes take about 5 to 10 minutes to make. They're very tasty, and one of the key points is the Acid Watcher diet is not a deprivation diet where I say no carbs, no fat.
And I'm sure that makes it a lot easier to stay with. One of the things that you bring up in your book is throat burn reflux. Can you explain a little bit about that and the difference between heartburn reflux?
Yes. One of the things that people have a misunderstanding about is, what is heartburn and, why that name? So heartburn refers to the symptom of burning in the stomach and chest. The esophagus, most people don't realize, actually sits on the heart. So when you have irritation of the esophagus, you feel it near the heart. Throat burn reflux is people that have acid reflux without the noticeable symptom of heartburn. 90% of the people in my practice have throat burn reflux. So instead of heartburn, people are complaining of chronic cough, hoarseness, excess throat clearing, and a lump-like sensation in the throat. And what it means is that the acid injury has likely been going on for so long that you're numb in the stomach and esophagus, and that stomach acid continues up where it starts to irritate structures very, very far away from the stomach.
So at that point, then, it's been quite some time that the condition's been going on.
Yes, exactly. And one of the and what some of the studies have shown is that one of the reasons esophageal cancer is the fastest growing cancer is that the doctors are not looking at people with the right symptoms, because when you have throat burn reflux, that is actually a higher risk group for developing severe esophageal disease and esophageal cancer, more so than heartburn. So people say, "Well, I don't have heartburn," as they're going, "I don't have heartburn," right? And they run to the drugstore and they take some antihistamines because they think they have allergies. But as time goes on, what's really happening is that esophageal disease is continuing, and it can get very, very severe. And you can imagine the shock of my patients when I say, "Listen, you've been hoarse for about 4 years. I think your esophagus needs to be looked at." And they're like, "What are you talking about?" Or, "What are you talking about?" I don't have heartburn. And when I show them the data, their hair stands straight up. And 10 to 15% of time, people with these chronic throat burn reflux symptoms will have severe changes in their esophagus. It can be reversible or controlled. So what I urge your listeners and readers to do is to think of these throat burn reflux symptoms, the chronic cough, the hoarseness, the lump-like sensation, as alarm symptoms, and get your esophagus looked at. Go to your doctor and say, "Please look at my esophagus." You will both be educating yourself and sometimes educating the healthcare providers.
I'd like to thank you very much for your time and information today. Is there a place that we can go for more information?
Yes, Becca. You can go to voiceandswallowing.com. That's one long word, voiceandswallowing.com. And also my informational page on Facebook, which is called Dr. Jonathan Aviv.
All right. Thank you very much for your time this morning, Dr.
Thank you.
Aviv.
Thank you so much, Becca.